Good morning, my friend. Tell me, have you ever looked at the little pill you take every morning and wondered what it's truly doing inside your body? Most people don't. They swallow it, take a sip of water, and move on with their day, hoping it keeps their heart quiet, their pressure steady, their doctor happy. But after 30 years of listening to hearts, both through stethoscopes and through stories, I've learned something. Not all blood pressure pills are the same. Some calm your heartbeat, some open your blood vessels, some quietly protect your kidneys from damage you can't even feel. And yet the real question isn't which drug is strongest, it's which one is truly right for you. I've met patients who've taken their medication faithfully, yet still feel dizzy, tired, or swollen in the ankles. I remember one woman, 72, who came to me and said, "Doctor, I don't even know if I'm better. I just know I'm exhausted." She wasn't failing her treatment was failing her. So today let's talk, heart to heart, about the three most common blood pressure medications in America: Amlodipine, Losartan, and Metoprolol. They each have their own way of helping your body and their own moments when they may quietly harm more than they help. I want you to understand them not as chemicals, but as companions. Three different kinds of helpers walking beside your heart. Because when you know what's truly happening inside you, you stop being just a patient and start becoming your own protector. Let's start with the first one, amlodipine. I like to call it the gentle hand of blood pressure medicine. It doesn't rush your heart or slow it down. Instead, it relaxes the walls of your blood vessels so your blood can flow freely, like a quiet river after a long rain. For many older adults, amlodipine is a wonderful choice because it keeps your pressure steady for 24 hours. But even the gentlest medicine has its whispers. Some people notice swelling around the ankles or a bit of puffiness in the legs. It's not dangerous in most cases, just a sign that your blood vessels have opened and fluid needs somewhere to go. I remember Mr. Thomas, 74 years old. He came to me saying, "Doc, my shoes feel tighter lately." We checked his pressure, perfect. Then I smiled and said, "That's your amlodipine doing its job. Maybe a little too well." We adjusted the dose and his swelling faded within a week. That's the thing with medicine. It's not about perfection, it's about balance. Now the second, losartan. If amlodipine is the gentle hand, losartan is the guardian. It doesn't just lower your blood pressure, it also protects your kidneys, especially important for people with diabetes or long-standing hypertension. It works deeper, like a gardener tending the roots rather than just trimming the leaves. And for many seniors, that protection makes a difference you can't see but your lab tests will show. Of course, no medicine is flawless. Losartan can sometimes cause dizziness, especially if you stand up too quickly, or a mild dry cough in some people. But for many, it's one of the safest long-term companions. I once treated Mrs. Harper, 70, a diabetic patient with years of high blood pressure. When we switched her from another drug to losartan, her kidney function improved within months. She didn't feel the change, but her body thanked her quietly. And finally, metoprolol. This one's like a calm friend who tells your heart, "Take it easy." It slows your pulse, letting your heart rest after decades of hard work. Metoprolol is powerful, especially for people who've had heart attacks or suffer from arrhythmia, irregular heartbeat. But like all powerful friends, it must be respected. It can cause fatigue, slower pulse, even cold hands or feet. Some people say they feel too calm, like their energy has dimmed. I remember Mr. Robert, 68, who came to me saying, "Doctor, I can't climb stairs like before. My legs just give up." His pressure was fine, but his pulse was only 48. We lightened his metoprolol dose, and within days his energy returned. That's when he told me something I never forgot. "Doc, I don't just want to live longer. I want to live better." That's the truth about these three: amlodipine, losartan, and metoprolol. Each one has its own song. The secret is not in choosing the strongest pill, but the one that sings in tune with your heart. If you ever wonder which one is right for you, don't rely on the label. Rely on how your body speaks. Do you feel lightheaded? Do your legs swell? Does your pulse slow too much? These are messages, not from your medicine, but from yourself. Because in the end, the best treatment isn't the pill you take, it's the understanding you carry. You know, after so many years in medicine, I've come to realize something simple. Medicine is not a battle between good and bad. It's a conversation between your body and the world that's trying to help it heal. Amlodipine, Losartan, Metoprolol, they're not just pills. They're reminders that your heart is still worth protecting. Each one offers a hand in its own way to steady your pressure, ease your heartbeat, or guard your kidneys. But none of them can replace what truly heals you: awareness, balance, and care. Sometimes the best thing you can do for your heart isn't another pill. It's taking a slow walk after dinner, laughing with your grandchildren, or forgiving yourself for something you've carried for years. Because your blood pressure doesn't just rise from salt or stress, it rises from the stories you hold inside, from the pace you keep when life asks you to slow down. If there's one lesson I wish every patient over 50 could remember, it's this: you are not old. You are alive. And your body still listens every day to how you treat it. So don't fear your medicine. Learn it. Don't just take it. Understand what it's doing for you. And if something doesn't feel right, don't stay silent. Talk to your doctor, adjust, and keep walking forward. Because health isn't about having a perfect heartbeat. It's about knowing when your heart is whispering and having the courage to listen.